So then Greg will then talk about the Simplified University of Canterbury Auditory-visual matrix sentence test.
Excellent, thank you very much. So I'm Greg O'Byrne from the University of Canterbury in Christchurch in New Zealand, and today I'm talking about recent work done with my students Cynthia McGill and Natalie Kerr, looking at the validation and reliability of the Simplified University of Canterbury Auditory-visual matrix sentence test for assessing speech perception in noise and in quiet in adults. Okay, so matrix sentence tests were first developed by Hageman in 1982 for the Swedish language. And versions of these tests have been created in lots of different languages worldwide, and the majority of them are European languages, but I also want to point out the two that I've highlighted here, which are the ones that we've natively created as auditory-visual matrix sentence tests, and I'll talk about how that can be useful in a little bit. So those of you who are familiar with the matrix sentence format will be aware of the somewhat demanding nature of the 5-word version for children and the elderly, particularly in the closed-set response mode that you see here. And this has led to the development of simplified matrix sentence tests, which reduce the stimuli to 3-word pseudo-sentences, usually with about 6 options, thereby reducing the cognitive and linguistic demands of the tests. So for the simplified version of the New Zealand matrix sentence test, we formed a 3x6 matrix from the last 3 columns of our 5x10 matrix, and this is it here.
10 old books. 8 red spoons.
And surprisingly, the 3x6 matrix gave really similar average slopes to the 5x10 matrix. They're pretty much equivalent. And so, although we designed this test primarily for use with children at the time, it raised the possibility, well, why not just use it for adults, given the auditory memory changes that occur with aging? So that's what we focused on for this particular study. We aim to evaluate our matrix sentence test in the auditory alone mode in older adults, both as a speech and noise test, but also in quiet. We wanted to compare its performance to the speech materials that are currently in use in New Zealand, namely the monosyllabic CVC, consonant, vowel, consonant, or AB words in quiet, and the quick-syn in noise, which is used quite frequently. We also wanted to examine what factors might affect the open and closed-set test-retest reliability. So we looked at 64 adult participants recruited from our university clinic. The average age of participants was 69 years, and we had a range of hearing impairments. This is the average audiogram that you can see there. And every participant underwent a 5-minute cognitive screening using the mini ACE. So just like the mocha, the maximum score was 30, and anything below 25 is considered a high likelihood of some degree of cognitive impairment. And for our participants that you can see here, we did have a number who were below that threshold. We didn't exclude any of them, but they just helped us in the analysis of the data. I don't mean they helped us in the analysis of the data, their data points helped us. So it's an adaptive speech in noise or speech in quiet test. And we were interested in finding the slope of the psychometric function, similar to the performance intensity function that's used in the CVC word lists. So we used the dual track paradigm of Brandt and Kollmeyer in this particular study. And here are some results. So starting with the testing in quiet, the CVC half-peak level and our closed and open set matrix SRTs were all highly correlated with the PTA with an R of 0.9. When we look at the correlation between the typical CVC word lists and our open and closed set SRTs, they're all extremely highly significantly correlated, so that's close to 0.9. Again, in terms of test-retest reliability, the matrix test in quiet was excellent with a Cronbach's alpha above 0.9 for all of our conditions and a measurement error of 1.6 to 1.7 dB. And remember, that's across the entirety of the audiogram, so it's very tight. Reliability was unaffected by age, by hearing status, or cognitive status based on the mini ACE outcome measure. Okay, so now for testing in noise. We had slightly different results with the closed set versus the open set response modes. We had excellent reliability for the open set response mode and good test-retest reliability in the closed set mode. It was unaffected by age, but poor hearing status and poor cognition did cause minor reductions in the test-retest reliability for speech in noise, most likely due to the cumulative increase in cognitive load. So comparing its reliability to the quick-syn, they're incredibly comparable in terms of their test-retest reliability, both around 0.9, and our open set measurement error was actually a bit lower, about 0.74 of a dB compared to the quick-syn. And we found a significant but moderate correlation between the quick-syn and the SRTs of both matrix sentence test response modes. So the SRT in noise for the open set mode was very weakly correlated with cognition, only accounting for around 9% of the variance. But we found no correlation between the SRT and age once we accounted for the hearing in terms of the 4-frequency pure tone average. Okay, so as I mentioned earlier, the UC Simplified Matrix Sentence Test was the first to have an auditory-visual mode, which is designed to assess lip reading or auditory-visual integration in paediatric, aged, and cochlear implant populations. So while we primarily measure auditory-visual enhancement in terms of the change in proportion correct at a fixed signal-to-noise ratio, because it seems more reliable than trying to track it adaptively. A couple of European teams in the last few years have established or pursued methods of measuring auditory-visual enhancement adaptively in terms of dB signal-to-noise ratio equivalence. So you can have a look at these papers, and hopefully some of you caught Tanguy Danar's talk on this morning. So I didn't mention it before, but we always record video along with audio when we're constructing our tests. It's basically what I do now with every single test that I record, just to avoid having to dub the video in the future if we decide to introduce some sort of audio-visual component at some point. So what I'm going to show you now are 6 sentences that our speaker never said, but which are edited together from around 400 video fragments. And I hope you'll agree it looks quite seamless.
2 small books, 10 green toys, 12 red bucks, 3 green books, 8 old toys, 2 red toys.
All right, so that's pretty fantastic. I do enjoy that test. Here's a quick summary slide for those of you with cameras, but this information's in the abstract anyway, that's fine. To keep things short, in conclusion, our simplified auditory-visual matrix sentence test shows clinical promise. It's for use as a multimodal diagnostic test of speech perception in noise and in quiet. It's valid, reliable, easy to administer, and suitable for clinical use in adults, and future work may establish its use for the assessment of auditory-visual integration abilities in both adults and in children. And I might just take literally 9 seconds right now to give you a super sneak peek of the Maori language simplified matrix test that we recorded just 3 weeks ago. Maori is the second official spoken language in New Zealand. So again, this is in auditory-visual mode.
E whetu nā keke iti. E iwa nā puna tawa. E rua nā peparahi.
All right, so thank you very much.